Greetings and welcome to another installment of Sinclair Educational Rounds. I'm Jim Ellermeyer. I'm a behavioral health therapist here at Sinclair, and today I'm joined by
Emily Reckner, PA student.
Jenna Beddick, PA student.
And also today we have a special guest. Today we're going to be discussing essential oils. We're joined by a special guest, which is who is Lynn Wagner, who is a licensed esthetician. And first of all, Lynn, you'll have to forgive my ignorance as to what a licensed esthetician is.
A licensed esthetician is someone who is licensed in the state of Pennsylvania to work on the face or do body treatments. So we study the skin. We cannot do what dermatologists do, but we work with acne, aging, different type of symptoms, and evaluate the skin, give suggestions, do certain procedures to the skin to try to help the patient.
Well, the young ladies that we have here, the PA students that we get here they're on their psychiatric rotation, and as perhaps everyone knows by now, Sinclair takes a holistic view of an individual mind, body, and spirit, and these young ladies expressed some interest in essential oils, and they have some questions for you, Lynn.
Well, I'll do my best to answer, and if I don't have the answer, I'll make sure I'll get one to them.
Jenna, do you want to start?
Sure. I actually had a question just based on what you just said. We had some typed up before this, but I guess my first question would be, how do you use, or if you do use essential oils in the treatment of skin?
Well, I do use oils in the treatment of skin. We use them in regard to what type of skin the patient has. For instance, if we're working with somebody with acne, or some issues in that way, I would lean towards, say, a melaleuca, which is a tea tree oil, antiseptic, antibacterial, which is really good for acne skin. If I'm working with someone with aging problems or maybe wrinkles or whatever, it could be frankincense, sandalwood. Geranium is an oil I love to use on the skin. It's good for all types of skin. It's actually a term we call the poor man rose oil, because rose oil is very, very expensive and very hard to get. It's very good rose oil. It runs about $350 to $500 for just a very little vial of it. But geranium is an oil that is very good for the skin, the same as rose is. So it's a very affordable oil and has very many chemical properties as the rose. So I use that if I need to try to have a patient who needs relaxation. Then we move into oils for mood. When we get into the psychiatric area with oils, there's a lot of oils that can be done for relaxation, for stress, sometimes to invigorate people, sometimes to relax them. I know the public usually thinks of just lavender, but there's many marvelous oils with many marvelous properties.
Thank you.
I have one. When I was doing some research, I read that people think that maybe pharmaceutical products could replace, essential oils could replace pharmaceutical products. So in what situations do you believe essential oils could replace pharmaceutical products in treatment for our patients?
Okay. Let me be careful how I answer that, because, as I said, essential oils are another part of integrative alternative medicine. Essential oils do cross over the blood barrier, and there's a lot of research online and on many websites about essential oils. My husband, Dr. Dan Wagner, uses essential oils many times with children on the spectrum with autism or ADHD. A lot of times when we're dealing with some mild depression, you'll have patients who really don't want to go the pharmaceutical route. So it'd be interesting to investigate some alternatives with different oils. With the oils, they do normally take longer to get results, not so much like a pharmaceutical drug where you almost get something instantly. And sometimes it's the same as in alternative medicine, where you may think one essential oil is the correct one for the person. But they may try it for a couple of days. It's actually not the best one for their body chemistry, so we would investigate using a different oil. Does that kind of answer your question?
That does. Thank you.
You're welcome.
So what you're telling us, Lynn, is that we may not always replace pharmaceutical products with essential oils. However, they can be a complementary addition.
Correct. Another incident I'd like to give, I'm going to use my 87-year-old mother as an example. She has a lot of problems with acid reflux and doesn't like to take certain prescriptions that her doctors might suggest. So I've been working with her with using peppermint oil, which helps with digestion. There's oil that has a blend that we use a lot of times with acid reflux. So they do help as an alternative. My mother does not like to take the prescription, so she tends to work with her acid reflux the natural way with peppermint oil, which is a very simple oil.
So you said that she takes it for acid reflux. How does she do that? Does she drink the oil as a mixture, or?
There's different ways we can do it. When you're working with essential oils, you have to have a very high quality brand to take them internally. Essential oils are available in any shop. You can go to any type of dollar store and find essential oils. How do you know what quality you get? It goes back to the same philosophy my husband, Dr. Dan, uses too when it comes to vitamins and supplements. You want quality, and of course that is a personal choice. My mother tends to like to put it in some water and sip it, but I also have used the peppermint oil where you can just put it on your hand and rub it onto the abdomen area. You can do that with young children. You can do that with adults. If there's a sensitivity to essential oils, then someone would use a carrier oil to dilute it. When you're working with infants and very small children, we usually go by their weight and the size to use a carrier oil to help dilute them. But a lot of times she'll just, like I say, sip it or rub it on her belly.
Lynn, one of the most common presentations here at Sinclair is for depression and anxiety. Could you, and I'm slightly familiar with some of the oils and what they do with those. Could you perhaps enlighten us just a little bit on some depression and anxiety issues that essential oils may help with?
I'll give you an example of one that I have noticed here at NutriPharmacy. A lot of times we have elderly women that come in and they do have some slight depression. I've noticed that the essential oil Wild Orange is just amazing for invigorating almost anybody. I know that there's so many oils out there, but the smell of the citrus is just kind of brings you up. And I have a lot of, like I said, elderly ladies in their 90s that use the essential oils, so they'll put them on topically. You can do them aromatically. I like the citrus oils because there's no one who says, oh, I don't like the smell of like lavender. They'll say lavender gives me a headache, or flowers. I don't like flowery smells. So I tend to go to a lot of citrus oils for uplifting. There are some of the tree oils which kind of ground us, because I think sometimes when we have some emotional or issues going on, we can get real scattered and the mind's turning and we can't shut it off and we're always thinking. So when you get into grounding oils that are tree-based, for instance, like frankincense and cypress and vetiver, they're all very grounding oils, and they tend to help ground us, which actually help our mental health also.
So you mentioned smelling the oils, and with your mother putting a few drops of the oils in water to drink it. Are there any other different ways you can use oils?
Yes, there are several different ways. We do them aromatically with a diffuser, or actually just opening up oil, putting maybe a drop in our hand, rubbing it together, and just breathing it. So through the nose, through the olfactory system, we can put them on topically. and we can actually take them internally, which would be taking the oil, for instance, in the water, or taking an oil straight into your mouth, or actually putting it in a capsule where you can kind of mix a couple different oils and take it as you would a supplement in a clear, like a gelatin capsule.
Lynn, sometimes in our little castle of Western allopathic medicine, we believe that we've discovered a lot of these things, like meditation and yoga and essential oils. Could you give us a little background on essential oils? I'm fairly certain it wasn't discovered yesterday.
Oh my, essential oils have been around forever. I mean, when we go back to biblical times, frankincense and myrrh was brought to the baby Jesus. Frankincense is a very, very sacred old oil. Going back to those two oils, we think of frankincense as the oil of the divine, and then the oil of myrrh is the grounding, like the Mother Earth, and the spiritual oil is the frankincense. They have been used as long as, I think, any type of herbal medicine's been used too. Essential oils are much more popular in other countries, in Europe, in the Middle East. I said India. I know that I know actually they're ahead of us in many countries. I believe I heard in Australia that they were actually in hospitals using some of the melaleuca, the tea tree oil, in their ventilating system, because you run into so many problems in the healthcare industry of picking up MRSA or germs in the hospitals. So they have been around forever. I think they kind of left our type of medicine, I think, in modern times because of just the change of pharmaceuticals. But there's a real trend coming back, and there's so much research on the internet. There's a website called PubMed, PUBMED, which you can just type in an oil and look at research. It's fascinating. And more of the doctors, there's actually a website called protocol.com where there's a lot of the medical doctors are getting involved with essential oils. So it's just really fascinating. It's been there. It's kind of cyclical, I think, that it's coming up as another alternative into our healthcare system now, because we have a lot of issues in our healthcare system, and I think a lot of people are looking for alternatives to complement it.
Well, Lynn, should an individual have some more interest in getting some education on essential oils, could you possibly provide us with your contact information so some folks could contact you?
Sure. The best way to get a hold of me would be at Pharmacy. Dr. Dan Wagner's my husband. I actually am involved with his business with the essential oils that we see patients and we retail, and we actually do educational classes here. There's a whole series of classes where we teach people how to look at your medicine cabinet, and if you have an interest of switching out some of the over-the-counter drugs to use essential oils. With essential oils, education is the key. Anyone in this industry can get a little bit overwhelmed, so the best way would be to contact me at Pharmacy, which is www.nutripharmacy.com, through my husband, and actually our phone number would be 412-486-4588.
Thank you very much, Lynn.
You're very welcome.
We're going to be ending another session of educational rounds today. And again, I'm Jim, and I'm joined by
Emily Reckner
and
Jenna Beddick.
And so much grateful for Lynn Wagner for providing some much-needed assistance for myself today. And to continue the conversation, please like us on Facebook, plus on Google+, or follow us on Twitter under Seclair Life, and keep an eye on any of these for our next live recordings Monday around noon to ask your own questions. You can also find this and other grand rounds on youtube.com/Seclair Video, and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. And please visit www.seclair.com for more about us and other articles about our great blog. And as always, be good to yourself. Until next time.